My name is Dr. Sean Price. I'm clinical coordinator here at the Fix in Fort Walton Beach. And in this video series, we're talking about non-surgical spinal decompression. And if you have any questions about what decompression is, please go back and watch our previous video. Now today, specifically, I want to talk about why would you choose non-surgical spinal decompression over surgery? There's a couple reasons for it. Number one, you have your general overall risks of surgery, being put under the risk of complications, risk of infection, all these different things that come along with surgeries in general. But specific to spinal surgery, if you have a spinal surgery done, if they go in and they come in and they surgically go in and remove tissue, or if they put a fusion in, or whatever kind of surgery they do, when they do this surgery, number one, if they put a fusion in, they're changing biomechanics. So that's going to cause the vertebrae above and below to carry more pressure, to carry more of the load of movement through the spine, which can actually wear those vertebrae out as well. The other thing is that even if they're not doing that, even a little bit of scar tissue can be a problem. So let's say that they do a surgery, and let's say that the surgery is not effective. Well, if the surgery is not effective, then you still have the original pain, but now on top of that, you have scar tissue that is causing even more complications. Let's say the surgery is effective, and you get some relief, and then 2 or 3 years later, you start having more issues. Now if they have to go back in, you've got scar tissue on top of the situation that you're dealing with. So scar tissue is a huge factor. It's something to really consider when you are looking at what you're going to do about a given situation. For example, herniated disc, bulging disc, sciatica, and so forth. So non-surgical spinal decompression has none of those risks with it. You're not going to have scar tissue. You're not going to have any of these negative long-term effects. So this is always, in my opinion, and clinically what we've seen, it's always a better option to go with the least invasive technology first. What will happen is with non-surgical spinal decompression, there's no scar tissue, there's no issues with anything like that. And even if for some reason it doesn't work, you always have the option of surgery, and you won't be any worse off for doing the decompression. Now, we've had a high success rate with patients in our office. We've seen hundreds of patients come through here. We've done non-surgical spinal decompression on these patients, and I've only seen 2 that have had to go to surgery afterwards. So we have a high success rate with it. It works extremely well. It's going to give you a strong chance of missing out or not having to have surgery, and there's no real negative side effect to it. If for some reason it doesn't work, you always have the surgery to fall back on. So that's why we consider spinal decompression to be the first option before considering surgery.